Watch Ian for you. September is Dystonia Awareness Month, though few people have even heard of this uncommon neurologic condition. So here to tell us more about it is Dr. Jeffrey Lahrmann, a movement disorders neurologist at Hartford Healthcare's Chase Family Movement Disorders Center. Doctor, thanks so much for being with us.
Thanks for having me on, Kara. So I just wanted to bring to everyone's attention the diagnosis of dystonia, which is a movement disorder characterized by sustained or involuntary muscle contractions, which results in abnormal movements or even postures. And these contractions are commonly associated with either initiating or continuing on with voluntary movements.
Yeah, so we've heard it often can be frequently misdiagnosed. What are the symptoms of dystonia that could be mistaken for something else? And what's the best way to get a diagnosis?
This is true. The diagnosis of dystonia is typically made by a movement disorder specialist like myself because it requires a detailed history and also a specialized physical examination done in the office. The dystonia can be commonly associated with twisting movements or tremors or even pains in the affected areas. And it's because of that there can be misdiagnoses of either different forms of bone and joint disease, essential tremor, or even other neurologic conditions.
So if someone is diagnosed with dystonia, do they also go to a movement disorders neurologist for treatment then?
Yes, this would be in the patient's best interest, as myself and my colleagues at the Chase Family Movement Disorder Center are all movement disorder specialists trained in the diagnosis, but also the treatment of dystonia. In our office, for instance, we offer all the current cutting-edge therapies in regards to treatment, including oral medication, physical therapy, massage therapy, acupuncture, botulinum toxin injections, and even deep brain stimulation. And it takes a specialist also to recognize the patient's individual symptoms and the type of dystonia they have, as this may be a tailored treatment plan specific for each patient.
Thank you so much for raising awareness and letting people know about the comprehensive care for Dystonia Awareness Month. We appreciate it.
Happy to. Thank you for having me on.
Absolutely. For more information, you can contact Hartford Healthcare's Chase Family Movement Disorder Center. The number's on your screen. It's 860-870-6385 or visit hartfordhealthcare.org/services/movement disorder center, or you can connect with the Dystonia Medical Research Foundation at dystoniafoundation.org.